Hey there guys, it's Liz here, your integrative health practitioner, and today's topic is going to be contraceptives. Now, just to make a disclaimer before we get started, every single female needs to make the choice that she feels is best for her. Okay, and this is not meant to cure, treat, diagnose any disease. This training is simply for informational purposes only. However, we are going to be going over the primary contraceptive options out there, like the pill, the different types of IUDs, implant, the shot, etc. And I want you guys to know the pros and the cons, the risks versus the benefits, so that you can take this. You can take this information and go and have a more educated conversation with your current practitioner, with your OBGYN, to make the decision that is best for you. But I feel like these details just are not discussed often enough. Practitioners don't have the time to sit down and talk to you about every single option and every single pro and con. So I pray that this leaves you better off than when I found you, that you feel more confident going and talking to your practitioner, and that you can make a smarter decision and you're aware of how these different options could affect your body. And of course, if you have any questions at all, feel free to post them in the comments. I will get to them as soon as possible. And if you have any friends, if you have any family members, if you have any other female in your life that you feel would benefit from this training, I would so greatly appreciate it if you could tag them or send this to them in a private message. We need to get these details out there. Now, there's a really important point that I feel the need to draw attention to before we get the ball rolling, and that is that birth control was originally created to prevent pregnancy. But nowadays it seems as though it's really used as a solution for just about any female symptom out there. I mean, you have periods that are too long, periods that are too short, periods that are too heavy. You have headaches, you have migraines, you have hormonal acne, you have endometriosis, you have PCOS, you have mood swings, and it just seems like any single symptom out there that seems to be somewhat hormonally related. I see it so often in the conventional medicine space that birth control is ultimately being used as this end-all be-all band-aid approach. And we're not necessarily getting to the root cause of why these symptoms are happening for women in the first place. And so then a woman is on birth control and maybe their symptoms get a little bit better. Sometimes that happens to women. Many times it's exacerbating the issues, or new issues show up like blood clots or weight gain that they didn't have before. And then you come off of birth control, and a lot of times women are experiencing post-birth control syndrome. And we'll talk about some of those issues that can happen as side effects of being on different contraceptives, but you can have the nutrient deficiencies, you can have a disrupted brain to ovarian connection, you can have other issues that arise. And so the issue that I have with birth control is that not because it's meant to prevent pregnancy for women, and that's absolutely a personal choice. I was on birth control for 10 years, okay? But I think it's important that we draw attention to the fact that it really is being used as a solution for something that it originally wasn't intended for. Okay, so if you're using it to prevent pregnancy, I do feel like that's one thing. But if we're using it to deal with hormonally based symptoms, we can't just throw a Band-Aid on it and say, oops, they're gone. Even if you feel like your symptoms improve once you're on a form of birth control, it doesn't mean that you got to the root cause. And so I think that's just so important to address. And I've done a lot of other trainings talking about natural ways to be able to balance your hormones and how you should be looking at testing and whatnot. And, if you guys have any questions that pop up, of course, like I said, put them in the comments. But I just want to make sure that we address that. And I need you to be aware of the risks versus the benefits, especially if you're using it for more than just pregnancy prevention. When it's symptom management, do we really want to use this when we know it's not truly addressing the root cause? And do we want to use these contraceptives when we know that it could have these side effects on the body? So there's a lot of moving parts. There's a lot of factors to keep in mind, but that's the purpose of this training. So first up is the pill. So typically when doctors are referring to the pill, they're referring to the compounded pill. So it has a synthetic form of estrogen and a synthetic form of progesterone. But then there's also another pill that's just progestin only, and that's basically like the mini pill is a nickname there. But most women I see are taking the compounded pill, so it has synthetic forms of estrogen, synthetic forms of progesterone. And the reason that I keep emphasizing the word synthetic is because so many times we think this is naturally regulating our bodies, right? It's going to naturally regulate our hormones. But I need you to understand that that's not true. So when you're taking synthetic forms of these hormones, they are not bioidentical, which means they don't have the same structure, they don't have the same makeup, and they don't have the same benefits as your body's own natural hormones. So what is the pill doing? What are a lot of hormonal based birth controls doing to balance your hormones or regulate your cycle? It's shutting off the brain ovarian connection. So literally it is turning off your body's communication system from your brain to your ovaries to ovulate. It's shutting it off. And it's trying to create its own through these synthetic forms of hormones. So when you go through, say you have a pill that you're on where it's like you have 3 weeks of the regular pill, right? And then it's, 4 to 7 days of one of the placebo pills or the sugar pills, right? When you are going on those sugar pills, when you go on those placebo pills and then you get your period, you're not actually getting your period. That's not a period bleed. That's a withdrawal bleed from the synthetic hormone medication that you're on. That's what that is. And I misunderstood this the entire time I was taking birth control. I had no idea. I thought it was completely regulating me. I was so excited that my body was naturally falling within a rhythm, et cetera, et cetera. And that's not what's happening. And so it really is just disrupting your brain and your ovarian connection. And so that's why the effect of birth control works at the brain level, works at the neurotransmitter level. And that's really important to keep in mind here, okay? So that works with not just the pill, but other forms of birth controls as well. But it's really important for you guys to understand is that it truly is disrupting your body's natural communication between your brain and your ovaries. So for us to say, or for a conventional practitioner to say, or any practitioner for that matter, to say that this is naturally regulating your hormones, that is not the case. That is false. And when you understand truly how birth control contraceptives work, you understand that that's really not even possible with what these contraceptives are made of. So I pray that this starts to open your eyes of how you may have been misled. But let's go into the pros versus the cons of the pill, okay? So the pro, it can be 91 to 99% effective, depending on how adamant you are about taking it. And that's probably one of the biggest cons is that you have to remember to take it every day. I know it was one of the biggest ones for me and for many other of my clients is that if you are not going to be diligent about making sure that you take it at the same time every day and taking it every day, you need it to work. You need to be consistent. So that may not be the best option for you if it's something that you don't want to have to remember to take on a daily basis. But as far as the serious cons for me, is when we get into the list of potential health side effects. And so guys, a lot of these carry over into some of the other contraceptives that we're going to be discussing, just so you know, and I'll refer back to them and be like, hey, it has a lot of the same side effects, potential side effects from the pill that we discussed. But that's why I want to take the time right now to list what could be correlated with taking the birth control pill, okay? And it's too important to not read it from my notes here because I want to make sure that I don't miss anything for you. So you can find a lot of these things within your insert in any medication that you're taking. You do get an insert with it and talks about how to take it, what's in it, the potential side effects, the potential risks, different trials that they've run with the medication. So you can read this stuff for yourself. There are certain things that I'll say they don't put on the insert that conventional medicine versus functional medicine is going to identify this a lot more often, things like post-birth control syndrome. So some practitioners may agree to disagree on that, but you can even read the inserts to find things such as blood clots, stroke, heart attacks, much more likely when you're on birth control, adverse mood changes, changes to your gut microbiome, leaky gut, irritable bowel syndrome, inflammatory bowel disease, a lot more likely when someone is on the pill. Certain cancers like liver, brain, breast cancer, increased risk for developing certain autoimmune diseases. It absolutely can contribute to changing of the chemistry in your brain. I already talked about how the brain and the ovary communication connection is completely shut off. So it is working at the brain level. It absolutely can increase somebody's risk for anxiety or depression. And in most birth controls, that is listed as a potential side effect. And I've had many clients experience that. You could have an increased risk for disruption in the adrenal functioning, in thyroid functioning. I've seen that. So it could ultimately turn into increase in fatigue for some people, weight issues for some people, anything that is associated with adrenal function or thyroid function could be a side effect down the road of taking birth control. It can be an increased risk for high blood pressure, of cholesterol, of diabetes. You can have increased risk for yeast overgrowth, and that can be in the mouth, in the gut, in the vagina, so vaginal yeast infections, decreased libido. The list goes on, guys. And so I wanted to make sure that we really covered the primary ones here, but know that they carry over. One of the primary things that I've learned from my own experience, as well as working with hundreds of different female clients, is that, even though these symptoms may be, and these side effects may be explained to you by your practitioner, I feel like a lot of times they're conveyed in a way and in a tone that makes them seem less common, that makes them seem very rare. And so I've seen it that many times when women are experiencing some of these symptoms or some of these side effects that we may address here, they may feel like, oh, maybe it's not correlated because I know this is super rare. I feel like women kind of lose confidence in the fact that these really could be correlated. And so I implore you to be grounded in who you are, what you feel, stay in self-awareness, and if you feel like these things are connected, please express your concern to your practitioner and know that no one knows your body better than you. So no matter how rare something may have been said to be, it doesn't mean that it couldn't happen to you. So that wraps up the pill and some of the side notes that I wanted to give about side effects. So let's go into the implant now, okay? So the implant is Implanon and Nexplanon were the two primary brands, and it's basically this little rod that gets inserted into your arm. It releases a synthetic form of progesterone, okay? So you still have synthetic hormones, but it can be left in there for several years, and it's a way to be able to not have to think about taking a pill every single day. It has that 99% effectiveness, but again, you also need to keep in mind that it still has some of the side effects of weight gain and acne and mood swings and breast pain and irritation or possible infection at the implantation site. I've had a couple different friends that have gotten that done and they've had pain or issues with that. Maybe it migrates a little bit. So of course there can always be complications, but that is one of the forms out there that you don't have to think about it like you do the pill every single day. You just still have synthetic hormones and you still have the ability to have the same side effects. Then you have the birth control shot or the depot shot, and this is given every 3 months, so you only have to worry about taking it 4 times a year, and it's 94% effective, but it contains synthetic hormone. Again, it contains progestin, and it still has that same side effect, song and dance with, irregular bleeding, headache, weight gain, mood changes, loss of libido, so same thing goes there. Then we have IUDs. So you have the hormonal IUDs and you have the copper IUD. So the hormonal IUDs, you're looking at like the Mirena, Kyleena, Skyla, Liletta. I think I'm pronouncing that one right. Aren't they? They're all such pretty names, right? It sounds so cute. It's just this little T-shaped device that you just get put in your uterus, and so releasing that synthetic hormone progestin, and it keeps you from getting pregnant. 94% effective. Wonderful. You don't have to touch it for 5 years. That's kind of how it's played off, right? But again, it has its own form of side effects here. So some of the main issues that you can have with IUDs are perforation and expulsion. So perforation can be literally where the IUD embeds itself in your uterus, or you can have expulsion where literally your body is trying to push it out. And it can be very painful. I've had several clients that have had that issue. How your practitioner places it and how skilled they are at it can absolutely make a difference. So you have those two issues. And then you have the typical synthetic hormone issues that can go along with it. You can have increased risk for the mood swings and low libido and, ovarian cysts, weight gain. You can have pelvic inflammatory disease has been a side effect there. So I've had women that have painful sex just because of how much inflammation happens there as well. So make sure you really pay attention to those symptoms if that's something you're experiencing if you currently have an IUD. Now, of course, the copper IUD, Paragard, doesn't have hormones in it, right? But what it does is it's preventing the sperm from swimming to the egg and therefore causing pregnancy. So that's how that one works. So there's no synthetic hormones in it, but you can still have the same risk for perforation and for expulsion. And they're still kind of debating the potential copper toxicity risks there. There still need to be more studies done. But if it were me and I absolutely had to choose between doing a hormonal IUD or a copper IUD, I personally, for myself, would be choosing to do the copper IUD, because then I don't have the synthetic hormones. I really struggle to even say that, but people ask me all the time, if I had to pick one of those two, what would I pick? And I would end up picking the copper. Now on to the patch and the ring. So they both use the same methodology there. You either throw a patch on to your arm or to your butt for 3 weeks, or you insert the ring for 3 weeks, and it's slowly releasing those synthetic hormones over those 3 weeks. You either take the patch off then, or you pull the ring out, and that's when you have that withdrawal bleed, you have your period, and it has the same side effects, a lot of the same side effects, same symptoms, same potential issues that we've been discussing. I wanted to touch very briefly on the Assure coil. It's actually been taken off the market in the US, but I did have somebody recommend that I touch on it. So ultimately, this metal coil is implanted in the fallopian tubes. The scar tissue builds up around that coil, and then essentially it keeps an egg from going through the fallopian tubes into the uterus to be ready for implantation. There have been a lot of issues with it, and metal has migrated to different parts of the body. It has an FDA black box warning, and it's been taken off the market, like I said, in the US. So I personally wouldn't recommend that one to anybody. Now let's wrap it up with some of the more natural options that we're getting into, okay? So a sterilization procedure for a female, so or like a tubal ligation, is an option. I have had clients that have come to me already having gotten that done. It blocks off the fallopian tube so that you can't have the sperm reach the egg, and so you'll still get your period, but not going to have the ability to be able to get pregnant. But it does come with its own form of potential side effects. In fact, you can have this post-ligation syndrome, and to be honest, conventional practitioners are probably going to completely deny it. I mean, if you try to talk to them about it, they probably will say it's not even a thing. You don't have to worry about it. Same thing with post-birth control syndrome as well. But these are things that people in the integrative medicine and functional medicine space have noticed to be patterns and tendencies that happen when women have gotten this procedure done. So you absolutely could have irregular periods, you could have heavier periods, you could have weight gain, you could have an increase in PMS symptoms, you could have hot flashes, you could have chronic fatigue. These are things that absolutely have occurred with women that have gone through that procedure, and seem to be more common with women that have used birth control before then doing that procedure. So that's something to keep in mind as well. Even though it doesn't use any hormones there, it's absolutely an option for you. It's a very permanent option as well, but it can cause further issues. What are some other natural pregnancy prevention methods? You can always use condoms. You have female condoms and you have male condoms. And again, you have to remember that these are also things that can help to prevent STIs, versus if you were just using the birth control pill or IUD or the depot shot, that's not preventing any sexually transmitted infections or diseases there, okay? So no matter what, keep that in mind if you're having more than one partner, okay? So as far as condoms go, don't really have to talk too much about that. Sure, you know what they are at this point, but I do need to kind of put a plug in here for trying to look for a less toxic option out there. As someone that really wants to encourage you to live a non-toxic lifestyle, you can find women have a lot of issues and different reactions and have pH balance disruptions and just issues because basically your vaginal area is like a giant mouth for you ladies. And so any chemicals that are found in the lubricants and the materials that are used for condoms, you have to consider. You have to consider. So I recommend the brand Lola so far. That's the one that my husband and I like, for full transparency. So it's Lola. There are a couple different brands out there, but get one that isn't full of all these different chemicals and scents and whatnot, because ultimately that still is adding to the toxic load within your body. So be smart about your condom use. You also have the withdrawal method or the pull out method. And if you're doing it correctly, it can be 93% effective. If you're doing average usage, can be about, 80% effective. But if you're using that in conjunction with also tracking your cycle or using the fertility awareness methods that I'm going to wrap up here talking about, it can be very effective. So it's never really doctor recommended there, but again, it is an option. So what's some of the last two ones that I would recommend, the top two that I feel are the best fit other than condoms? I know some people are like, I'm not wearing a condom. So what would I say if you're totally against condoms? What do I think are the best things for you to do? I personally would use the withdrawal method in addition to one of these other two methods that I'm going to talk about right now. So you have the FAM method, so that's the fertility awareness method, and that basically means tracking your cycle. Use an app, use whatever you need to do, your calendar, to know where you are at in your cycle when you are in your fertile days. I love using My Calendar. It's a free app on iPhone. I think they have an Android version of it as well, but I love that. You can also track your other symptoms, your mood, all these other things. So it's a great way to track a lot of different things surrounding female health, okay? But it'll also tell you, hey, this is when your fertility days are, this is when you're ovulating, etc. And using that in conjunction with the withdrawal method can be very effective. So you can either avoid sex on the days where you are more fertile, or make sure that you are using a condom at least just on those days. Okay, so you can either do that, or last but not least, what I wanted to touch on is the FemTech devices. So these are fertility tracking devices, and there's two pretty common ones. One is Daysy, so DAYSY, and then you have Natural Cycles. So these literally are devices that help you to track your fertility. You can do this a lot with, I know a lot of women take their temperature and things like that. So there's several different ways for you to be able to track this. But even if you're not trying to prevent pregnancy, if you're looking to get pregnant in the future, these are very effective ways. Just having the fertility awareness method or fertility tracking devices can help you to be able to conceive more easily or avoid conception if you're not ready to conceive at this point. So I pray that this helped you guys. Again, any questions that you have, please put them in the comments. Tag people that you know could really benefit from this. And I pray that this helps you just make a more informed decision with your current practitioner.